Hi, and welcome to our live event. We're really excited that you joined us today, and we have Dr. Nguyen here with us.
Hello, everybody.
And if you are doing the program right now and you're a member, you've seen Dr. Nguyen in several of our videos, right? So if you haven't, Dr. Nguyen is a consultant with Exhale, and she is a board-certified critical care physician and pulmonary physician, which is focuses in on lungs. So we're really excited to have you today, so thanks for joining us.
Well, thanks for having me, everyone.
And if you are joining us for the very first time to find out what Exhale is all about, we are a lung rehab program that is all online. Traditionally, lung rehab has been in an environment where you have to go into a facility. And so sometimes there are difficulties getting to a lung rehab because it may not be in your area or it may not be covered by insurance. And so our vision really was to make this valuable rehab really available for anybody, anytime. So that's our goal. So we're joined today by Dr. Nguyen, and we're going to ask her a couple of questions, and then we will answer any of your questions. So if you have questions, be sure and log them in, and we will definitely get to those as soon as we can. So I wanted to start out today, Dr. Nguyen, by just kind of talking about what diseases that you feel would benefit from lung rehab.
So lung rehab is a really great program for a lot of my patients. Everything from chronic illnesses such as COPD, which is chronic obstructive pulmonary disease, to asthma, interstitial lung disease, or another term is pulmonary fibrosis. I have patients that have had lung transplant pre or post. They would benefit from that. And more recently, we've been sending patients who have had COVID, where it's affected their lungs. They have also been shown to benefit from pulmonary rehab. And one other thing I forgot was pulmonary hypertension. I do have some patients that I also send to pulmonary rehab, but basically any patient that has an underlying lung disease that would benefit from improving their shortness of breath and just their overall health.
Great, fantastic. So maybe you can tell people what lung rehab is all about. Like, what do you do in lung rehab?
So lung rehab, that's one of the biggest questions some of my patients have. They just said, well, are they just going to show me how to breathe? That's not it. So this is a program where you learn from different specialties. So everything from how to breathe, how to use our medications, learning about your underlying disease process. So whether it's COPD or asthma or pulmonary hypertension, just kind of learning the concepts and why things are going on. But then also, you would benefit from what healthy lifestyle changes should we do. So it's a little bit of everything. So it's not just focused on breathing, but it's the overall, what can we do to help you understand and benefit and then improve your overall breathing.
Yeah, and one of the most beneficial things from lung rehab is really strength training, right?
Absolutely.
And endurance training to kind of build those muscles. So talk a little bit about strength training and how you think that benefits people with lung disease.
Okay. Strength training is really, really important. So again, people say, well, is this just focused on helping me breathe? But remember, your strength is also very important for your breathing muscles. So as you build up your muscle strength, once again, doing daily things, whether it's just walking across the room, whether it's now being able to go and shower, these muscles that you build back up will increase your ability to do your day-to-day activities, build up your endurance, and then overall this will help with your breathing in the long term.
So as a practicing physician, do you recommend lung rehab for patients?
Oh, absolutely. I don't think I've met one patient who has not enjoyed an experience with pulmonary rehab, but if you come to me, obviously there is something going on, and if you have symptoms, even just a short course, whether it's just a couple of weeks or you go through the entire program, I've had a lot of my patients come back and tell me how much that pulmonary rehab has changed their lives. So just learning again about what's going on, why they have that lung disease, just different coping mechanisms on what to do when you have the shortness of breath, and then overall looking at their strength and their ability to even just walk in and see me in clinic again has been wonderful to see their growth after going through pulmonary rehab.
That's awesome.
Yes.
I know that there are a lot of people who, even just walking across a parking lot is very challenging to get into, the office. And after pulmonary rehab, it really gives them the tools to be able to do some of those things that they couldn't do before. Getting groceries even, seems to be a monumental task to some people with severe lung disease. So definitely an important part of that as well. Yes. So we wanted to answer questions since we're limited on time. We're trying to keep this to a 30-minute spiel this time. I know we went over last time in our very first one. We're getting the hang of it now, but I wanted to answer some questions. So if you all have questions, please just log those in for us, and we're going to take a look at questions that you might have about rehab, questions that you might have that you want Dr. Nguyen to answer, and then we'll try to log these regularly. We're going to try to do events on a regular basis so that everyone can enjoy them, whether you're a member of the of Exhale or not. So. Dennis, do you have our first question?
No questions at the moment.
All right. No questions. Well, I wanted to talk a little bit about what we do in online lung rehab versus what you do at an in-person rehab. So we do get questions a lot about what's different in the online version versus if I were to walk into an in-person. And the answer is really simple, and that is whether or not you do it at home or you do it at a facility with other people around you. I know that COVID really put a damper on these type of programs. So would you mind to comment about, what you know about some of the programs that had to shut down during COVID?
So while we were going through COVID, a lot of my patients, obviously, if you have some underlying lung diseases, you're at higher risk of getting COVID. So we couldn't have the group kind of setting. Usually it's a one-on-one experience that you would get at an actual physical pulmonary rehab. But even getting there and having our patients be safe, it was very difficult. So I did have a couple of patients who did end up using some online services and just using the concept that they learned there in their everyday lives. And so this is what pulmonary rehab is for. You start with the program, you understand what's going on, but you have to apply that. So I think it's been really useful to have that at your fingertips, just to log back in and saying, okay, I remember this. What else can we do to kind of redo that at home? Mm-hmm. So I think it's really important. I love this program for that ability to let's just get back on and see what we can do to put this back in our life.
Yeah, awesome. And we have a physical therapist, mm-hmm. And we have a yoga expert as well. And they've really developed a lot of programs for people who are concerned about, I can't do normal exercise online. I can't get online and do things like normal people can do because mm-hmm. my lungs can't handle that. And so we have things like chair yoga, mm-hmm. and that you don't get out of your chair, or exercises that you only use portions of your body and not your entire body at once, but it still builds strength, it still builds endurance. And even 5 minutes worth of our exercises really helps to increase your lung capacity and be able to do some of the things that you weren't able to do before. All right, let's go back and see if there are any questions. No questions at this time. Okay, we're answering all the questions. I love it. All right, so we're about 15, 20 minutes in, so we'll go for another 5 minutes or so. If you do have questions, please log them in. We would love to answer your questions. Another thing about our lung rehab program that we really wanted to focus in on is there was no program out there that was online that was able to do an assessment and then develop a personalized program that was based on that assessment. There were some really great programs out there, but they really had, the program was the same for every single person. And so what we wanted to do is really level up and be able to give an initial assessment and then base their program on that. So if you do have pulmonary fibrosis, you're getting the classes that are beneficial for that. And if you can walk around and get groceries and do all of that stuff, that your exercise classes are really tailored for you. If you can't do that and you need the chair yoga ones, then they're tailored for that. But it is important, I think, that we have personalized programs that are developed for them, and that they have access to our team. So we do have the ability to have some respiratory therapists that can answer questions. And we have had several people that have called in and say, hey, can you just go over that lesson about breathing techniques again for me? And they can do it with the therapist at that time. And so that's been really beneficial. We've gotten some really great feedback on that as well.
Very good.
Okay, it looks like we have a question here. So I have pulmonary hypertension and I have a heart catheter with a pump that I have 24/7. One of the side effects from the medication is that my oxygen levels lower. What is a good exercise for this?
So I think from what we're understanding from this question is your oxygen levels run chronically low. So I always tell patients what you can do needs to be individualized, and it shouldn't be the same thing that your neighbor's doing. So I always tell people we're going to start off slow. Okay, we have to do and try to figure out what can we do within your restraints of your disease process that can help you feel better, but at the same time not pushing it so much where we're going to run into trouble. Like Wendy said, I think we have a couple of videos on chair yoga, things that are more focused on patients that are not able to get up and out of things as easily. Starting off with that, rebuilding the strength on that, trying to make sure that we're building up that breathing. The muscles will then in return also get stronger too, and eventually hopefully we can get to the point where we can actually build up on that strength. But I would probably start off with things that are not as active, starting off just in the chair, but even those are beneficial for you too.
Yeah. For sure. And that the pulmonary hypertension actually brings up a really great point. We are filming this week, in fact, courses on pulmonary hypertension so that we will be able to add very specific courses for people with pulmonary hypertension. And we anticipate those being available and uploaded at the end of the month. So we're excited about that. We are being advised both by Dr. Nguyen and by another doctor that specializes in pulmonary hypertension, and pretty much all of his patients are pulmonary hypertension. And so we're excited to have him on board as well. So we anticipate in just a couple of weeks having some really specific courses for you. In the meantime, doing exercises that are in a chair, that are very low level, using one part of your body and just a few minutes at a time, so that you're not really straining yourself, can be beneficial.
Yes.
All right. Any other questions? Okay. Well, I think we're coming right up on the end of our segment this time. So we hope that this was beneficial to you. We thank Dr. Nguyen so much for taking time out of her super busy schedule to join us today and give you guys some information on how beneficial lung rehab can be. And we will have another one next month. We're going to start these every month. So join us again. We'll have information that we send out on the next one, and we hope that you log in. So join us too for our lung rehab program at joinexhale.com. It's joinexhale.com, and we would love to serve you.
All right. Thanks for having me, Wendy.
Thanks so much. All right. Bye-bye. Are we clear?